for the ENT Area Agency on Aging presentation. In the next decade, 1 in every 5 Americans will be retirement age, according to the US Census Bureau, and is also said that by 2030, all baby boomers will be older than 65. In El Paso County, it's estimated that roughly 31,000 Coloradans will reach retirement age over the next 10 years. To help the growing population prepare for this, the ENT Credit Union, as well as the Area Agency on Aging, has developed this retirement series that we have started 7 years ago and brings us up to the current session, which we've expanded to the full state of Colorado, as well as having a fall retirement session and a spring retirement session. So welcome to those who have sat in on this before and those new ones who are seeing it for the first time. My name is Pamela Hogard, and I represent the Area Agency on Aging. We also have Jessica McMullen, who is our Policy and Communications Manager. She is behind the scenes, making sure that the webinar runs smoothly. And she will be sending out a survey to each and every one of you, probably tomorrow morning, due to the amount of time that the webinar will be taking. So she'll be sending that out tomorrow morning, and we have some special little things of interest relative to that survey that our ENT representative, Emma, will be telling you more about. So briefly, most of you probably know about the Area Agency on Aging, but just in case you don't, we provide programs that promote independence, well-being, and quality of life for older adults. And we specialize in providing Medicare and retirement education webinars. We also publish a yellow book, which is a senior information and assistance directory, and the Colorado Adult Medicaid Program and Veterans Benefits Guide. The Senior Insurance Department is part of the Area Agency on Aging and is home to our state health insurance assistance program, which Roma, our presenter, will tell you more about today. But that basically we offer free education and counseling with all things Medicare. Briefly, housekeeping, keep your microphones muted. Put your questions in the chat if you would. This program is jam-packed with Medicare information. So in the interest of time, if you'll put your questions in the chat, and then Roma will address those at the end with as many as she can, and then she'll explain more about how she wants to handle that. So now I'd like to introduce our partner of the series. This is Emma Protzik. She is the Community Education Specialist for ENT Credit Union, and she's going to say a few words about ENT and explain our survey.
Awesome. Thank you so much, Pamela. Thank you everyone too for joining us this afternoon/evening for this session. So just a little bit more about ENT Credit Union for those who aren't familiar with us. We've been serving Colorado since 1957, and we are currently the largest and ranked Colorado's #1 credit union by Forbes. ENT is a not-for-profit financial institution committing to improving our members' financial quality of life. And currently we are serving over 400,000 members with over 40 service centers all along the Front Range. And this is ENT's 7th year partnering with the Pikes Peak Area Agency on Aging, and we love it every single year to get this information out to you guys. And for the survey that Pamela was talking about, we're actually giving away a $50 Amazon gift card for each session for those that complete the survey. So make sure to check out your inbox, give us that feedback, and you'll be entered to win that Amazon gift card. And if you attend every session, you can be entered to win a gift card for each one. So we got 5 sessions coming up. It's $250 to Amazon. So definitely look out for those surveys. So I'll pass it back off to Pamela so we can get our speaker introduced for this evening.
Great. Thank you, Emma. I would like to introduce our speaker for the evening, Ms. Roma Costanza, who is the Area Agency on Aging Medicare Specialist, as well as the Medicare Specialist for the state of Colorado. She is our state health insurance program coordinator for 9 counties with this AAA. She's been counseling, she's been doing SHIP counseling, Medicare counseling for 21 years, and she has extensive knowledge of Medicare and has developed the actual Medicare 101 series that you will see today, as well as the 4-part Medicare series that we offer through the library district. She is Colorado's guru, and she is our coordinator. Please join me in welcoming Roma. It's all yours, Roma.
So good afternoon, everyone. Thank you for joining us. As Pamela mentioned, we do have a lot of information to get through today. I'm going to try and keep it as close to an hour as possible. So I'm going to hold all questions until the end. If you registered late, you may not have received the email that I sent out earlier around 3 o'clock. Then I included a copy of the slides as well as the handouts that I'll be referencing. However, let us know if you did not get that email, and I'm happy to send it to you either tonight or tomorrow morning, or you're always welcome to the recording. Jessica will be sending out an email that includes not only the survey, but a link to the recording and the handouts on our website as well. So you'll be able to access those at your convenience. We will again hold questions until the end, and then I'll take questions for about 15 or 20 minutes at the end of the presentation. Any questions I don't get to before we have to cut out, you are welcome to email me, and I will respond to your email with your specific question, hopefully by the end of business tomorrow. I think that's all the housekeeping I have. So I know we have people still signing in, but we're going to go ahead and get started just so we can get going. All right. So again, good afternoon. Welcome to Medicare 101, or Medicare Who Me, everything you never wanted to know about Medicare. We are going to start with the SHIP program. Again, as Pamela mentioned, I am the coordinator for the SHIP program, which is the State Health Insurance Assistance Program. This is a federally funded program that's available in every county of every state, at the very least through a toll-free number in each state. So everybody has access to a SHIP counselor. This is a program that's specifically designed to provide unbiased information and education on all things Medicare. We do not sell or endorse any specific programs or products. We are true consumer advocates here to provide information and education only. Our SHIP office covers a total of 9 counties in the state of Colorado. And so you are always welcome to visit us by telephone. I've included our local number in Colorado Springs, as well as our statewide toll-free number. Depending on what county you're calling that toll-free number from, it should route you to the SHIP counseling office closest to where you're calling from. And again, every county and every state should have access to this program. This program is provided at no cost to the beneficiary. So we are going to talk about pretty much everything Medicare, including the different parts of Medicare, Medicare Part A for hospitalization, Medicare Part B for outpatient services, the new prescription Part D benefit, Medicare Part D, as well as we're going to talk about Medicare Supplements, also known as Medigap, and Medicare Advantage plans, sometimes referred to as Medicare Part C. Quickly, we're going to start with who runs Medicare. How do you get Medicare? So Medicare benefits are actually determined by Social Security. So Social Security is who keeps track of your eligibility for Medicare, and you're eligible for Medicare by paying taxes in taxes through employment, either through your own employment or perhaps through a spouse or dependent or parent's employment. So Social Security determines who's eligible for Medicare. Social Security is actually who you go to enroll in Medicare. Social Security provides you with your initial Medicare card, and they are available basically Monday through Friday from 7 a.m. to 7 p.m. in all time zones. You can contact Social Security either by their toll-free national number, which I've listed on the slide, or their website, ssa.gov, or you can contact the local Social Security office here in Colorado Springs for our region. Whether or not that office is open to in-person visits or not, you would have to call and find out, but you can always contact them by their phone number. Once you're enrolled in Medicare, then Social Security wants nothing to do with you. So once you're enrolled in Medicare, any questions you have regarding Medicare benefits or services, you would contact Medicare directly, or the Centers for Medicare and Medicaid Services, otherwise known as CMS. CMS is who actually administers the Medicare program. They determine what benefits are going to be covered. They process claims for those benefits. They pay the providers directly. You can contact Medicare either by their toll-free number, which is available 24 hours a day, 7 days a week, 365 days a year, or you can go to medicare.gov, the website. There is no brick and mortar location for Medicare anywhere. So the only way you can get in direct contact with Medicare is either by the toll-free number or by going to their website. So again, Social Security is who determines who's eligible for Medicare and enrolls you in Medicare. Once you're enrolled in Medicare, any questions or concerns you have would go directly to Medicare or CMS. So who can have Medicare? Pretty much any US citizen who becomes age 65 or older and has contributed into the payroll tax system by paying Social Security taxes. And that could also be through the railroad retirement system. You can also become eligible for Medicare at any age based on becoming or being determined disabled by Social Security and being on Social Security for at least 24 months. You can also receive Medicare at any age if you are diagnosed with end-stage renal disease and are receiving kidney dialysis. By being diagnosed with Lou Gehrig's disease, also known as ALS, and then any lawfully admitted resident alien who has resided in this country for at least 5 consecutive years would be eligible to purchase Medicare. So when should you enroll in Medicare? Well, these days you don't have to necessarily be retired to be eligible to enroll in Medicare. And many people are working past age 65, which is the initial eligibility age. But when you first become eligible for Medicare, whether it's based on turning 65 or because of disability or any of the other reasons listed, you will enter into what's called an initial enrollment period. The initial enrollment period is a total of 7 months. So you have a 7-month window, which begins the 3 months prior to the month of your 65th birthday or initial eligibility month, the month of your 65th birthday or initial eligibility, and up to 3 months past the month of your 65th birthday or initial eligibility. That is your window of initial enrollment. And that is when you can enroll in Medicare without penalty. If you enroll in Medicare during that time frame, anytime within the 3 months prior to the month of your birthday, your Medicare would go into effect the month of your birthday, the first day of the month. If you enroll anytime, including the month of your birthday or the months after, there would be a delay in when your Medicare goes into effect, 1 to 2 months. There are other times you may enroll, which we'll talk about next. But if you don't take advantage of either the initial enrollment period or one of the subsequent enrollment periods we're going to talk about, there is possibly a penalty if you enroll later. So we've already talked about the initial enrollment period. The other enrollment period that might be of importance to some people would be the special enrollment period. The bottom line is Social Security basically only accepts one excuse for not enrolling in Medicare during your initial enrollment period, during your initial eligibility. And that is if you are actively employed with employer group health coverage, or you're the spouse of someone who is actively employed with employer group health coverage and you're covered by that spouse's employer group health coverage. That is the only excuse Social Security will allow for delayed enrollment into Medicare. And you can delay enrollment into Medicare based on that active employment with employer group health coverage until you decide to stop working. Once you decide to stop working, then you would get an extended amount of time to enroll in Medicare from the time the employer group coverage ends, when the employment ends. So you would get an 8-month window from the time employment ends to enroll in Medicare without penalty, regardless of what time of year that is. If you don't enroll during the initial enrollment window when you first become eligible, or based on a special enrollment period because you continue to work, the only other time you'd be able to enroll in Medicare is during what they call the general election period or general enrollment period. The general election period is every year from January 1st through March 31st. If you are enrolling during the general election period because you missed the other 2 opportunities to enroll, your coverage would not start until July 1st of that year. So there would actually be an extended delay in your effective date for Medicare if you're using the general election period. Now, having said that, they are changing that rule, but that change in rule does not go into effect until 2023. So you'd still have to worry about having that delay. If you're enrolling during the general election period because you did not have or take advantage of the other 2 enrollment periods, quite honestly, you're looking at probably having to pay a penalty for late enrollment. And we will talk about that penalty in more detail in a few minutes. So Medicare.gov, the Medicare website, does allow or has an option for you to create an account, your own account in the Medicare.gov website. There are advantages to creating a Mymedicare account. It allows you to keep track of your claims. It allows you to see claims being submitted by your doctors in real time. It allows you to keep track of a drug list that you can use year after year during the annual open enrollment, which we're going to talk about shortly, to review different drug plans that are being offered from year to year or advantage plans. It has an electronic health records option that you would be able to use and give access to your doctor to. So there are a lot of great features on the Mymedicare account that might be advantageous for you to use or have. Medicare does not require that you set up a Mymedicare account, but they do strongly encourage it. And I did include in the email earlier, and it will be available on our website at a later date, the instruction page on how to create a Mymedicare account. So now we're going to talk about the different parts of Medicare, starting with Medicare Part A. Things to take into consideration before enrolling in Medicare Part A. First thing you need to understand is if you are already collecting a Social Security or Railroad Retirement income benefit, when you become eligible for Medicare, whether that's based on age or disability, if you're already collecting an income, you will automatically be enrolled in Medicare Part A. You will have no choice about that. If you are actively employed with employer group health coverage, or your spouse is actively employed and you're covered under their employer group health coverage, again, you may be able to delay enrollment into Medicare A and B in favor of that employer group health coverage. However, keep in mind, again, if you're not actively employed or the spouse of someone actively employed and covered by employer group health coverage, if you don't take advantage of the initial enrollment period or a special enrollment period based on employment, you'd only be able to enroll during the general election period, January through March, and you could be facing a penalty for enrolling late in Medicare. Now, having said that, if you're eligible and entitled to Medicare Part A at no cost, you would not have to worry about a penalty for late enrollment. The only time someone would have to pay a penalty on Part A of Medicare is if they are not entitled to Part A at no premium. They would have to pay a premium for Medicare Part A, and that's when a penalty could be applied. Most of us will be entitled to Medicare Part A at no cost when we become eligible. And that's going to be based again on paying into the system, paying into the Social Security tax system based on employer taxes, whether it's our own or our spouse's. To be eligible for free Part A or premium free Part A, you would have to have at least 10 years worth of work history paid into that system. Now that 10 years worth of work history can be accumulated over the course of your entire lifetime, or it can be accumulated within the first 10 years of your working. So if you started working right after high school and you work nonstop for 10 years, after that 10 years, you've accumulated enough credits to have Part A at no cost when you become eligible. If you did not work consistently, or you didn't start working until after the kids went off to college or something like that, as long as you work 10 years before you become eligible for Medicare, you will still have earned Part A at no premium. So it doesn't matter what 10 years you accumulated that work history, as long as it totals 10 years of work history over the course of your lifetime. If you don't accumulate those 40 quarters of work history or 10 years of work history in your lifetime before you're eligible for Medicare based on age, you can purchase Medicare Part A. Purchasing Medicare Part A is not cheap. If you have less than 30 quarters, you could pay as much as $471 a month just for Part A in 2021. And that premium does change every year. If you're not sure if you have enough work history paid into the system, and you're not able to get premium-free Part A based on a spouse's work history, I would encourage you to contact Social Security and ask them where you stand. Because again, Social Security is who keeps track of all that, and they would be able to tell you how many quarters you have and whether or not you're entitled to premium-free Part A. Once you're enrolled in Medicare Part A, this is what it covers. So Medicare Part A, the basic rule of thumb is Medicare Part A is for inpatient services, Medicare Part B is for outpatient services. So Medicare Part A is primarily going to cover inpatient hospitalizations. Medical hospitalizations, Medicare Part A will cover all costs for any reason that you are inpatient in a hospital for up to 60 consecutive days, minus a one-time per admission deductible. For 2021, that per admission deductible is $1,484. Again, that's a per admission deductible. So if you are admitted as an inpatient to a hospital multiple times in a year, that deductible could be applied each and every time. There would have to be at least 60 days between the time you're discharged from an inpatient stay to the time you're readmitted to an inpatient before they could apply that deductible again. So if there's less than 60 days between the time you're discharged and the time you're readmitted, you may not have to pay that deductible a second time. But just be aware that's a per admission deductible and not a per year deductible. Medicare defines a hospitalization benefit period as a 90-day window. Fortunately, most of us will never see more than a handful of days in the hospital because they try and get us in and out as quickly as possible these days. So this would be an extreme scenario to be in the hospital even for more than 5 or 6 days. But Medicare does consider up to 90 days as a full benefit period that they will cover all or part of. Medicare also covers inpatient psychiatric hospitalizations, but they do put a lifetime maximum of how many days they will cover for inpatient psychiatric stays, 190 lifetime days. For medical hospitalizations, there is no maximum. So you could be hospitalized 2-3 times a year, every year for the rest of your life. Medicare will still cover whatever services you needed as long as they were medically necessary when you were admitted. Medicare, while you're in the hospital, will cover any and all costs for whatever services you need to be in there for. But there are some exceptions. So all costs are all inclusive in how Medicare pays for a hospitalization. But some of the things Medicare does not pay for under that all-inclusive coverage would be personal convenience items such as your own telephone, your own TV. Honestly, most hospital rooms come with your own individualized telephone and TV. So that's not as big a deal as it used to be. Medicare will not pay for you to be in a private hospital room unless it's either deemed medically necessary and ordered by a doctor, or even in a situation where there may not be any other space available. They're not going to make you pay to be in a private room if that's where you have to be. No part of Medicare, A or B, will pay for any of the first 3 pints of blood you might need as a transfusion. Don't ask me why. I have no idea. Don't ask me how much it costs for the first 3 pints because I don't know the answer to that either. But for some reason, Medicare does not pay for the first 3 pints of blood you might need. If you need more than 3 pints, then Medicare will pay for starting at pint number 4. Medicare Part A will not pay for private duty nurses or room sitters, and Medicare does not cover self-administered drugs while you are inpatient in a hospital. And that's primarily because self-administered drugs are what would be covered under Medicare Part D, the newest benefit of Medicare, which we will talk about shortly. So for most services and most medical needs, Medicare pays everything that you need to have while you're inpatient in the hospital. A few things that they will not pay for. Another benefit of Medicare Part A is skilled nursing facility care. In order to be eligible for Medicare to pay for skilled nursing facility or rehab after a hospitalization, Medicare does require that you have been inpatient in the hospital for at least 3 days prior to being discharged to a rehab for recovery or rehabilitation. If you're in the hospital for 1 night or 2 nights, and then the doctors try to discharge you to a rehab facility, be mindful, Medicare will not pay for you to go to that rehab facility. You have to have at least 3 full inpatient hospital days before you're discharged to a rehab for Medicare to cover rehab. If you are in the hospital for 3 days or longer and then discharged into a skilled facility for rehab or recovery, Medicare will pay 100% for that rehab for the first 20 full days or 20 consecutive days. If you need to be in that skilled facility for rehab or recovery for longer than 20 consecutive days, Medicare will continue to pay everything except for the daily coinsurance. For 2021, that daily coinsurance is $185.50 per day. So what that means is the first 20 consecutive days of that skilled facility stay for rehab or recovery is covered at 100%. From day 21 up to a maximum of day 100 consecutive days, Medicare will pay everything except for $185.50 per day. If for some reason you find yourself in that rehab for longer than 100 days, Medicare stops paying completely at day 101. Because at 101 days, Medicare will start considering that rehab or skilled facility stay long-term or custodial, meaning you have not been able to recover enough to be able to go home and be on your own after 100 days, then the likelihood of you being able to go home and be on your own becomes pretty slim. So they will give you up to 100 days at a time in a rehab for recovery or rehab in the hopes that you become well enough to go home. Even if it's to go home with additional rehab at home, at least you can go home. If you haven't been able to get well enough to go home after 100 days, Medicare starts considering that stay long-term care or custodial and does not cover that kind of service. Medicare only pays for medically necessary services, not custodial services. At that point, you'd have to look at either privately paying for your continued stay in that skilled facility. Perhaps you've purchased long-term care insurance to help cover the cost of that skilled facility stay, or you may qualify for Medicaid, the state assistance, to help cover that facility stay. The last benefits available through Medicare Part A are home health care and hospice care. Both benefits, if a doctor certifies that you're eligible and meet the eligibility criteria and orders those services for you, are typically covered by Medicare at 100%. Deductibles do not apply to home care services or hospice services. And there typically are no limits to how long you get those services. Now, having said that, home care used to have limits based on either amount of time someone came in to see you and help you at home, but they no longer have that. As long as the doctor can certify that the home health care is either helping you maintain your current health status or continuing to improve your health status, Medicare will continue to let a home health care agency come in. Having said that, keep in mind that Medicare only pays for medically necessary home health care. So Medicare will pay to have a home health care person come in and check your bandages, check your wounds, check your whatever you were in the hospital for or rehab for. And once they've done that, then they go home. They can come in to provide rehabilitation or that kind of thing. What this will not pay for is any sort of homemaker services. So there's no light housekeeping, there's no cleaning, there's no laundry service, nothing like that, no meal prep of any kind. Only medically necessary services would be covered under this benefit of Medicare. For the hospice care benefit, again, Medicare covers pretty much 100% for any services that you receive provided by a hospice. Because a hospice service is designed to help someone be comfortable in an end-of-life situation, meaning you've pretty much decided that your condition is not going to improve and you're at an end-of-life scenario, Medicare will pay for the hospice facility workers to come in and make you comfortable and do whatever it takes to make you comfortable. What Medicare does not pay for in either of these situations is room and board. So if you're in a facility, Medicare does not cover that facility stay, but they will cover all services you receive while you're in the facility. And again, for most part, there is no limit to how long you can receive these services. So that's pretty much Medicare Part A in a nutshell. Medicare Part B, again, Medicare Part A's rule of thumb is for inpatient. Part B's rule of thumb, it's for outpatient. So for Medicare Part B, things to take into consideration. Again, if you're already collecting the income from Social Security or the Railroad Retirement Board, when you become eligible for Medicare, Social Security will try and automatically enroll you in Medicare A and B. However, if you are actively employed and covered by employer group health coverage, or you're the spouse of someone employed and you're covered by their employer group health coverage, you can delay enrollment into Medicare based on that employer group health coverage. And when that employment ends, you would have that extended amount of time, 8 months, to enroll in Medicare without penalty. Now, even Social Security will encourage people to enroll in Part A if you're entitled to premium-free Part A, even if you're working. And you can do that because it's not going to cost you anything. However, the bottom line is you don't have to enroll in either part of Medicare if you are still actively employed and have employer group health coverage. So if you wanted to delay all of Medicare until you stopped working, you could do that. If you enroll in Medicare Part A and it's free to you, keep in mind that Medicare Part A would usually be secondary to your employer health coverage. Even if you enroll in Part A, most people will delay enrollment into Medicare Part B if they are working, because Medicare Part B is the part of Medicare everybody has to pay a premium for. So no matter what your situation, everybody pays a monthly premium for Medicare Part B. That monthly premium is also means tested, meaning how much you earn in employment income or annual income could affect how much you have to pay for Part B. There may be some situations where you need Part B or are going to be required to get Part B. Basically, if you are already enrolled in a Medigap or Medicare Supplement, you have to have both A and B to do that. If you want to enroll in a Medicare Advantage plan, you have to be enrolled in both A and B to enroll in an Advantage plan. If you are retired military and are eligible for TRICARE, which turns into TRICARE for life when you get enrolled in Medicare, TRICARE absolutely requires that you enroll in both A and B to enroll in TRICARE for life, or you risk losing TRICARE benefits completely. If you have any questions about that, then you'd want to contact your local DEERS office. If you are a veteran, and I get this question from veterans all the time, if you are a veteran and you use the VA services for all your health care, all your prescriptions, all your everything, should you enroll in Medicare Part B? Well, the bottom line is Medicare, quite frankly, does not require you enroll in A or B for any reason whatsoever. Enrolling in Medicare A and B, whether you're eligible and entitled to it at no cost or not, is optional. There are definite advantages for veterans to enroll in Medicare A and B. For example, VA services are typically provided to veterans for VA-related needs. Whereas Medicare, you would be able to use Medicare for any medically necessary reason anywhere in this country at any time whatsoever. And Medicare will always cover those services. VA, you may be limited to where you can go. You have to have a VA system or a VA provider within proximity. So there are definite advantages to having both VA and Medicare A and B. But again, whether or not you will enroll is optional. If you choose not to enroll in Medicare in favor of VA now, or when you first become eligible, keep in mind that you would be allowed to enroll in Medicare down the road in the future, but you would probably pay a late enrollment penalty for not having enrolled when you first became eligible, because VA is not considered a good enough reason for not enrolling in Medicare when you first become eligible. So there, you would have to wait for the general election period, delayed enrollment until July, and then potential penalties for not enrolling sooner. So again, enrolling in Medicare Part B, should or shouldn't you? Again, if you're actively employed with employer group health coverage, or the spouse of an active employee with employer group health coverage, you can delay enrollment into Medicare in favor of that coverage. When the employment stops, you have that extended 8-month window to enroll in Medicare without penalty, or you'd be subject to waiting till the general election period, January through March each year. Coverage starts in July, and face potential penalties. So how much does Medicare Part B cost? Well, for 2021, the base premium for Medicare Part B for everyone, $148.50 per month. That's per person per month. That premium, if you are collecting a Social Security income, will be automatically deducted from your Social Security income when you are enrolled in Medicare. And again, if you're collecting an income when you become eligible, Social Security will automatically enroll you in Medicare and start collecting that premium. If you're not collecting a Social Security income when you become eligible or enrolled in Medicare, the premium can be paid monthly, either by electronic funds transfer or quarterly by paper draft. And that would be paid directly to Medicare or Social Security. If for some reason you are looking at paying a late enrollment penalty for not enrolling in Medicare when you should have or could have, how that penalty is calculated, Medicare will add on 10% of the monthly premium for every full 12-month period that you delayed enrollment into Medicare beyond your initial or special enrollment periods. So 10% per year multiplied by however many years you delay that enrollment. They're going to take that number of years. So say you wait 3 years, 10% times 3 years is 30%. They are going to take that 30% and multiply it by whatever the monthly premium is when you become eligible or when you actually enroll. So if you were eligible 3 years ago and you're going to enroll in 2021, you're going to have a 30% penalty. They're going to multiply that 30% by $148.50. Whatever that comes out to will be tacked on top of the $148.50 every month forever. And ever and ever and ever. Penalties never go away once you've accumulated them. And the longer you wait to enroll, the higher that penalty gets, because that 10% keeps accumulating every year you delay. And again, penalties last forever. They never ever go away. The Part B premium does change every year. Typically, it's going to change in the form of going up or increasing. The penalty that's calculated, if you are subject to a penalty, once it's determined, once that amount of money is determined, will stay the same and be tacked on to whatever premium is every year when it goes up. So the penalty will always be the same, even though the premium will increase from year to year. And then keep in mind that Part B premiums, as well as Part D, as in drug premiums, are now means tested. What that means is if you have a high annual income, you may have to pay a higher Part B premium because you have a higher annual income. For most people, the threshold doesn't start until $88,000 annually for a single person, $111,000 or $176,000 annually for a couple filing jointly. Anyone whose income is below those thresholds does not have to worry about paying a higher Part B premium. If your income is at or above those thresholds, you may have to pay a higher Part B premium based on that higher income. And there are 6 levels of threshold to worry about. And the higher the income, the higher extra amount you would have to pay. Honestly, Social Security will let you know if they think that you have to pay a higher Part B premium based on annual income. You will receive a notice from Social Security. Keep in mind that they are basing that notice or that expectation that you will have to pay a higher Part B premium based on income on the most complete, most recent income tax filing they can get their hands on, which is most likely going to be about 2 years old. If that information is no longer the situation you were in, so say 2 years ago, you were working full time, you had a pretty good income. Between now and then, you have retired and your income is not quite that high anymore. If your income is not at those thresholds when you become enrolled in Medicare and you receive a notice from Social Security saying that you're going to have to pay a higher premium based on income, but your income is simply not at that level anymore, you can contact Social Security and tell them that so that you're not subject to paying a higher premium when your income is no longer that high. And whatever notice you receive from Social Security will outline the process for doing that. So anytime you get something from Social Security, there's always a couple of paragraphs in there that say, if you disagree with this, and it outlines the process for disagreeing with what they're telling you. So just keep that in mind so that you don't feel that you are going to be subject to paying a higher premium if your income is no longer that high. Once you're enrolled in Medicare Part B may have some out-of-pocket costs. So there is a deductible for Medicare Part B services, $203 this year. So remember, the Part A deductible is a per admission deductible. Every time you're admitted to the hospital, $1,484. For Part B benefits, it's a one-time annual deductible per year. For 2021, $203. That deductible, of course, does go up a little bit every year, but it doesn't go up much. For example, last year, the deductible was $198, so it went up $5 this year. Once that deductible is met, then Medicare will pay for most Part B services at an 80-20 split. They'll pay 80% of what they allow, and you would have to pay the other 20% unless you have insurance that would pay that 20% for you. I included a chart for the means testing, the different levels of income and extra amount of Part B premium you may have to pay. I'm not going to go over that with you. So what does Part B cover for all that money? Basically, again, Medicare Part B is going to cover all your outpatient needs. So that's going to include any and all types of office visits with your doctors, all lab and x-ray services. Medicare covers medical, surgical, anesthesia services. Medicare will actually pay for a medical second opinion. Medicare Part B will start covering blood at pint number 4, because again, no part of Medicare covers the first 3 pints, but Part B will start paying for blood at pint number 4. Covers your emergency ambulance transports, covers your annual vaccines, the flu shot, the pneumonia shot. Medicare Part B covers the shingles vaccine for administration purposes. So Part B is what pays for the shingles vaccine to be administered or put in your arm. Covers all your physical, occupational, and speech therapies. Medicare Part B covers your durable medical equipment such as oxygen, walkers, wheelchairs, that kind of stuff. And Part B does have some limited coverages for services such as chiropractic, podiatry, and optometry. Again, all services must be considered medically necessary for Medicare, any part of Medicare to pay for them. And it is absolutely your doctor's responsibility to tell Medicare that something was medically necessary so that Medicare will pay for it. A few things Medicare Part B does not cover. So for all the wonderful things Medicare will pay for, there's always something that they won't pay for. A real biggie is routine annual physicals. Also will not cover routine foot care, routine eye exams or the glasses associated with them. And even in a non-routine eye service, Medicare does not pay for refractions of the eye. Medicare does not cover hearing aids or the fitting of them. Does not cover dental in any way, shape, or form, although that conversation is on the table finally. Nor will it cover anything they consider cosmetic or not medically necessary. Now, having said that, there's always things Medicare doesn't cover, but there's always exceptions to the rule. So even though Medicare does not cover routine physicals, Medicare's answer to the routine physical is called a Welcome to Medicare preventive visit. Now, let me tell you, the Welcome to Medicare preventive visit is not a physical. It is a visit. It is an in-depth visit, an in-depth discussion with when you visit your provider that is going to establish your health history, your social history, your mental health history, all of that kind of stuff. But it's not a physical, it's an in-depth discussion with your provider. And based on that discussion, your provider might suggest or recommend some future preventive services. The Welcome to Medicare preventive visit is a use it or lose it benefit right now. So when you first are enrolled in Medicare, you will have up to 12 months to take advantage of that Welcome to Medicare visit. Regardless of whether or not you take advantage of that visit, you would still be provided with an annual wellness review. An annual wellness review is, again, just an in-depth discussion with your provider about the previous year's physical, mental, social history, and may result in the provider suggesting or encouraging you to get some preventive services within the next year. Now, Medicare jumped on the preventive service bandwagon when preventive services became popular, I'll say. And so Medicare covers a lot of preventive type services. Medicare, when they first started covering preventive services, would usually pay the regular benefit of an 80-20. Their goal when they started covering preventive services was that by 2020, they would cover all preventive services at 100%. They met that goal. So any service that is labeled or classified as a preventive service covered by Medicare, Medicare will pay for at 100%. The best way to get a full list of what preventive services Medicare will pay for is by getting a Medicare A new handbook. You can get a Medicare A new handbook either by calling 1-800-Medicare and requesting that they mail one to you. I would encourage you that they mail one specific to Colorado, or you can go to their website and download it as a PDF or view it as a PDF on their website. In the Medicare A new handbook, there's about a 25 or 30 page section that just goes into detail about what preventive services are covered and what's included in those services. And anything that's described in that section, if it's a preventive service, it would be indicated by a little blue apple icon next to that description. But again, the Medicare A new handbook is going to be the most comprehensive list of what services Medicare will pay for as a preventive service. So that is Medicare Part B in a nutshell. We are going to move on and start talking about what kind of insurance options are available once you are enrolled in Medicare A and B. We're going to talk about the two primary options available on basically what I consider the open market. Anybody with Medicare A and B can consider buying these two products We're going to start with the first product, Medicare Supplements, also known as Medigap. So Medicare Supplements, which is the term I tend to use because I've been doing this for a really long time, is the same thing. It's the exact same thing as a Medigap. So it's two terms for the same coverage. Medigap just being the new, more fandangled terminology that's come out. Basically, a Medigap policy, when you have A and B of Medicare, a Medigap policy is a private insurance policy that's sold by a private insurance company, and it's solely and specifically designed to pay the balance that Medicare Part A and Medicare Part B may have left over after they've paid their part first for any service, period. Let me repeat that. Medicare Supplement or Medigap insurance is a private policy you purchase from a private company, and it is solely and specifically designed to pay the balance that Medicare Part A or Medicare Part B left over after they paid their part first, period. So Medicare Supplement insurance is specifically designed to pick up whatever balance Medicare left over for any service you receive after Medicare paid their part first. That's all it does. Medicare Supplement insurance policies are required to follow all federal and state laws designed to protect the consumer. If you purchase a Medicare Supplement policy, it must say on the policy itself, Medicare Supplement insurance, those three words in that order. The term Medigap comes from the thought process that it covers the gaps in your original A and B of Medicare, basically the balances left over. Medicare supplements are standardized, which means that on a federal level or a nationwide level, there are a limited number of plans to choose from or levels of coverage to choose from. And every company in every state that sells Medigap coverage sells the same levels of coverage. So no matter who you buy a policy from or where you buy it, you're being offered the same preset number of plans or levels of coverage to choose from, with the exception of the 3 states that have an additional level or 2. Even though they're all selling you the same products, the same levels of coverage, costs can vary for those levels of coverage from company to company, based on the plan or level of coverage you choose, based on the company you purchase it from, based on the zip code that you live in, based on whether you're male or female, smoker, non-smoker. There are a million different factors that insurance companies may include in determining what the premium is that you would pay specifically for any supplement plan that you choose to purchase from them. But again, because they're all selling you the same products, the same levels of coverage set in stone, it does pay to shop around because they're all going to sell you the same thing based on the level of coverage you choose. And there's no advantage to paying more from one company than another company because they're selling you the same stuff, the same products. So to have a Medigap, keep in mind that a Medigap or Medicare supplement only works with original A and B of Medicare. A and B of Medicare are your primary health coverage. They pay first, and then the supplement would be your secondary, and they would pick up whatever balance Medicare A and B left over. If you are already enrolled in an Advantage plan, you cannot have a supplement. You can only have one or the other. If you have other types of credible coverage, such as you're retired military and have TRICARE for life, if you have the option of a retirement health plan through an employer, whether it's para or a federal retiree or a private employer, if that employer offers a health benefit that's designed to coordinate with Medicare, you may not need any other coverage besides that benefit. And you certainly would not need more than one coverage. So again, be probably an all or one or the other kind of scenario. Regardless, Medicare is still primary in this situation. And Medicare is good anywhere in the United States of America and or our territories with any doctor, hospital, or provider that accepts it. for any medically necessary reason. So having original Medicare as your primary insurance and a Medicare supplement as your secondary insurance might be a better option for someone who intends to travel a lot around the country or intends to visit other areas of the country for extended periods of time, because you don't have to worry about networks. You don't have to worry about where you are or who you can see. You only have to worry about finding a provider that takes Medicare. So it can be the most affordable option if you do intend to travel or be out of state or out of area for extended amount of time. Again, you have to have or be enrolled in both A and B of Medicare in order to be enrolled in a Medigap or Medicare Supplement. And there are specific timeframes that might be better times to buy a supplement than others, because Medicare Supplement plays by slightly different rules than other types of coverage available with Medicare. So the best time to buy a Medicare Supplement for most people is going to be in what's called the guarantee issue period. The guarantee issue period means that you have an opportunity or a window of time to purchase a Medicare Supplement insurance to go with your A and B of Medicare without any questions asked or without any underwriting, where the insurance company gets to look at your health history. So for most people, purchasing a Medicare Supplement or Medigap during a guarantee issue period is going to be their best time to get that kind of coverage, because insurance companies cannot deny covering you based on health history. That also applies in Colorado to people who are under 65 and on Medicare due to disability. Otherwise, it would be impossible to get a supplement because of the disability. However, if you're under 65 and get a guarantee into a supplement, keep in mind that you probably will have to pay a little bit higher premium because of that disability, but you would get another opportunity to age into Medicare when you turn 65 and get another open guarantee issue period at that time to reduce the premium. So the guarantee issue period basically means that when you enroll in a Medicare supplement, you would not be subject to underwriting or subject to the insurance company looking at your health history and potentially turning you down if they don't like what they see. Sometimes also referred to as an open enrollment period. The guarantee issue period is 6 months. And that 6-month clock starts ticking as soon as Medicare A and B are in effect. So basically, even if you enroll in Part A 2 years ago, but you're just now enrolling in Part B, that 6-month window of time doesn't start ticking until Part B goes into effect. Excuse me. But once it starts ticking, once that clock starts ticking, it can't be stopped. And once that 6-month window expires, it's not likely to get another one. There are some exceptions to that rule, but for most of us, you get that one-time shot to get into a supplement without underwriting. Why is that important? Because Medicare supplements are not subject to the Affordable Care Act rules. And the Affordable Care Act rules say anybody can buy insurance without underwriting, but that is not the same rule for Medicare. So that you get this 6-month window where you can buy this kind of insurance without underwriting, without them looking at your health history and turning you down. But once that window expires, it's gone. And anytime you try to change companies or plan levels, even if it's within the same company for a Medicare supplement, you could be subject to underwriting and the insurance company could turn you down if you have pre-existing health issues. Now, when I say pre-existing health issues, I could mean something as minor as blood pressure issues that have been under control for years, or it could mean history of cancer or anything. The criteria that any company uses for their underwriting process can vary from company to company. Some companies can be more lenient on their underwriting, other companies may not be. And they may be very stingy about who they'll allow outside of a guarantee issue window. Excuse me. So for anybody who has any sort of pre-existing diagnosis, that is something to keep in mind. Now, again, there are exceptions to that rule. So if you enrolled in Medicare and you had retirement benefits that were being offered to you by your employer, and you had those benefits for a few years, and then suddenly the employer decided it's not cost effective to keep you on those benefits and cuts everybody off, because that would be an involuntary loss of coverage. It wasn't your fault that benefit got cut off. It would open up a window of guarantee issue into a supplement for you based on that involuntary loss. Other types of involuntary loss of critical coverage could be if you enrolled in Medicare A and B, even though you were still actively employed and had employer coverage. When that employment ends, you would be provided a window of guarantee issue based on the loss of that employment coverage. Probably the most common way to get a guarantee issue into a supplement is if you are enrolled in a Medicare Advantage plan and you were either taking advantage of the test drive or you move out of the area or something like that. We will talk about that specific scenario with Medicare Advantage plans when we get to the next section. But basically, involuntary loss of any other type of critical coverage would be enough to grant you an additional guarantee issue window into a Medicare supplement. Things Medicare supplements do not cover. Same things Medicare A and B do not cover. Long-term or custodial care, dental or vision, hearing aids, private duty nurses or room sitters, outpatient prescription drugs, which will be covered under Part D. Again, Medicare supplements are designed to pay the balance Medicare left over after they paid first. If Medicare does not pay for something, the supplement will not pay for it either. So it's not there to pick up what Medicare didn't pay. It's there to pick up the balance Medicare left over when they did pay. So if Medicare denies something, the supplement will deny something. If Medicare does not pay for something, the supplement will not pay for it. It will only pick up the balance after Medicare pays first. Handouts that are available either by email that I sent earlier or available later when I re-email that information, or you get it off our website. One of the handouts, this is a chart that outlines the different levels of coverage that are standardized for you to choose from as a Medicare supplement. And basically, this is going to tell you what benefits the supplement will pay after Medicare paid their part first. Levels of coverage are classified as plans. So plan A, B, C, D, F, G, K, L, M, and N. Don't get that confused with Medicare parts. So Medicare has parts A and B. Supplements have plans A through N. Each level of coverage benefits are listed under the plan designation. And basically, it's just telling you what that plan covers after Medicare A or B pays their part first. I'm not going to go into detail on this chart, but again, you're always welcome to email me with questions about this information or for more specific information after the presentation, and I will respond as quickly as I can. Or you're welcome to attend our sessions in October. It's a 4-part Medicare series where we go into much, much more detail about all these parts that we're talking about tonight. So I'm able to spend much more time on A and B and supplements and advantage plans and Part D in that 4-part series. But this is going to be the standardized levels of coverage you have to choose from. Every company that sells supplements anywhere in this country sells what's on this chart, period. There are no other options for them to sell, and they cannot add to these plans or subtract from them. So they are all literally selling you the same products, the same levels of coverage. And again, that's why it pays to shop around. The other handout that I included was this one. This is put out by the Division of Insurance in Denver for Colorado. This says September of 2020. I just received the 2021s in the mail Friday, and I did include that in the email that I sent earlier, and the 2021 will be posted on our website later. Basically, this is put out by the Division of Insurance. It's going to list all the companies that are licensed to sell Medicare supplements in the state of Colorado. There are over 40 of them, keep in mind. But the benefit of the handout, it is going to tell you all the companies that are licensed to sell these plans, and it's going to give you an idea of what each plan charges for each level of coverage that they offer. So it will give you price comparisons, not price quotes. So don't use this tool as a price quote tool. It's going to tell you approximately what these plans charge for your age group for the different levels of coverage, so that you can compare apples to apples and decide what companies you might want to contact from there. But this is not designed to give you exact price quotes. It's designed to give you ballpark quotes. So it's going to show you which companies charge more, which companies charge less, and give you a place to start. But don't look at this information as an exact price quote for you. Any company that you decide to contact directly would be able to give you either a price quote over the phone or perhaps in the mail. Again, anybody who wants additional information or to talk about it in more detail, always welcome to email us or call us, and we will talk to you one-on-one. So that is Medicare Supplements. That is option number one for coverage to go with Medicare. Now we're going to talk about Medicare Advantage plans, which is option number two. Medicare Advantage plans are newer products on the market, really exploded onto the Medicare market in the last several years. Medicare Advantage plans are an entirely different kind of health coverage to go with Medicare. Entirely different animal. People who enroll in a Medicare Advantage plan are basically enrolling in a insurance plan with a private insurance company, but that private insurance company has contracted directly with Medicare to act as Medicare for you. So when you enroll in an Advantage plan, you're enrolling in a plan that is going to become your Medicare, and Medicare is going to pay them to do that. When you enroll in an Advantage plan, you still always have original Medicare. You still have to pay your Medicare Part B premium. Original Medicare never really goes away, because as soon as you disenroll from an Advantage plan, poof, you already are automatically back to original A and B of Medicare. But while you are enrolled in an Advantage plan, the Advantage plan becomes your Medicare. All Medicare services and coverages go through that plan instead of Medicare now. That's why it's also sometimes referred to as replacement coverage. And that plan, that Advantage plan, becomes your primary everything for Medicare. While you're in that Advantage plan, you still have all the rights and protections of original Medicare. You still are entitled to receive any and all services original Medicare would cover. But these are called Advantage plans for a reason, because they may have some advantages in the form of extra benefits that Medicare A and B may not pay, such as routine vision, hearing, dental, free gym memberships. And there are any number of extra benefits that these plans are allowed to offer these days. I can't even keep track of them anymore. And that's one of the big advantages of Advantage plans. But again, this is an entirely different kind of insurance. Most Advantage plans may also include Part D drug coverage at no extra cost. When you use original Medicare A and B and you buy a Medicare supplement, you have to buy Part D separately in addition to that. When you have an Advantage plan, it becomes your A and your B, and most of the time your Part D all rolled into one package. And so that is the other advantage of Advantage plans. There are some additional eligibility requirements to enroll in an Advantage plan. You must live in the plan service area. For all intents and purposes, that is going to be your county of residence. So you must enroll in an Advantage plan that's available in your county of residence or service area. And typically you may be limited to using that plan only in your county of residence or service area. Again, you have to be enrolled in both A and B to be eligible for the Advantage plan. And you may only be able to enroll in the Advantage plan either during your initial enrollment period. But the other advantages of Advantage plans is that they have annual enrollment periods, where you have an annual opportunity to get into, get out of, or switch from one to another Advantage plan if you choose to do so. With Medicare Supplements, you do not get that. With Medicare Supplements, you get that 6-month window of guarantee issue, and that's it. If you want to change plans, you can always drop a supplement to get into an Advantage plan, but you may not be able to drop an Advantage plan and get back into a supplement. So again, initial enrollment period, when you first become eligible for Medicare. And then there are the additional enrollment periods with Advantage plans. You have the annual election period, which we typically just refer to as open enrollment each year. That's the October 15th through December 7th window. During that time frame, you can get into, get out of, or switch from one Advantage plan to another. Any change you make during that time frame goes into effect January 1st. A couple years ago, Medicare started a new enrollment period specifically for Advantage plans. It's called the annual Medicare Advantage Plan open enrollment period. This is an additional enrollment period that runs from January 1st to March 31st each year. During that time frame, if you are enrolled in a Medicare Advantage plan, as of January 1st, you can use this additional 3 months to either switch to a different Advantage plan or get out of Advantage plans and go back to original Medicare with a Part D. And that's all. And then there's always the special enrollment periods that I mentioned earlier for Advantage plans, which I'll talk about more in a second. Again, annual enrollment period or open enrollment, January or December, October 15th through December 7th. Any change goes into effect January 1st. Advantage plan open enrollment, January 1st through March 31st. Yes, that does coincide with the Medicare A and B general election period, but not to be confused as the same thing. Only applies to people who are already enrolled in an Advantage plan as of January 1st to either change to a different plan or get out of Advantage plans altogether. Special enrollment periods, specifically for Medicare Advantage plans, are basically going to be the same kind of scenario that any special enrollment period with Medicare falls under, which is loss of other credible coverage. So you would be eligible to get a special enrollment period if you are enrolled in an Advantage plan and that plan leaves your service area or county of residence. So they decide to leave El Paso County and they don't want to sell that product or offer services in that county anymore. That's considered involuntary loss of coverage. If you move from El Paso County to Denver County, you cannot take your Advantage plan with you. You'd have to disenroll from the plan here and re-enroll in a plan in the county you move to, whether that's in-state or another state altogether. Again, that's involuntary loss of other coverage because that's not your fault. In that situation where you have involuntary loss of that coverage, what that grants you is a special enrollment period that could either be a guarantee issue period into a supplement for a very small 63-day window, or the ability to enroll in another Advantage plan in the area that you move to. The most common special enrollment is going to involve what they consider a test drive or a trial right for Advantage plans. Basically, because there has always been so much confusion about what Advantage plans can and cannot do and what they do and do not do, Medicare has created a test drive opportunity. This test drive is available to people who either enroll in the Advantage plan from the start, as soon as they become eligible for Medicare. Medicare allows you up to 12 months to test drive the Advantage plan to decide if that's the kind of coverage that you are going to be comfortable with for the long haul. If at any point during that 12-month window, you decide Advantage plans are not for you, you'd be able to get out of that plan, even if it's outside of an annual enrollment period, and still have guarantee issue into a Medicare supplement. Keeping in mind that this does coincide with the initial 6 months of guarantee you get into a supplement, but it kind of extends it for up to another 6 months. And you'd still have guarantee into a supplement because you test drove the Advantage plan first. The other way you could use it is if you get Medicare, you enroll in a supplement from the get-go, and you maintain a supplement without any breaks in coverage. And one day, 1 year down the road, you just decide you want to try Advantage plans. You'd be able to drop that supplement, enroll in an Advantage plan, test drive it for up to 12 months. If you decided at any point within that 12-month window you didn't like it, you'd be guaranteed back into the supplement you left. If you went beyond that 12-month window, before you decided you didn't like it, you would not be guaranteed back into your supplement, and you'd be subject to underwriting if you tried to purchase another supplement. Keep in mind that even with Advantage plans, you still have to pay your Part B premium. Now, there are some Advantage plans out there these days that may offer to reimburse all or part of that Part B premium. That doesn't keep you from having to pay it first. So they may reimburse, but they're not going to pay it for you. Some Advantage plans may also have an additional monthly premium on top of that. Any Advantage plans in this area are offered at 0 premium. So you wouldn't have to pay any additional monthly premium besides Part B, but not all of them. And keep in mind, Medicare Advantage plans, you will always or typically have to pay a copay at the time of service for services. So whereas Medicare A and B and a Medicare Supplement are designed to pay the cost of service, Medicare Advantage plans are designed that you have a cost to pay at the time of service in the form of a copay usually. So there will be out-of-pocket costs. Even though that premium is low or 0, they're going to make some of that up in copays and co-insurances that you will have to pay. But you will, of course, always get your Medicare covered services, but it would all go through that plan. Again, most plans will include Part D drug coverage at no extra cost. You may be limited to what providers and facilities you can use based on that plan's preference or network. Although in a medical emergency, you're covered no matter where you're at or who you see by that plan. And of course, costs and benefits, cost sharing will be different versus Medicare and a supplement. And just to make things a little bit more entertaining, there are multiple different kinds of Advantage plans. I am not going to go through the different kinds of Advantage plans, although those slides are included in this presentation. Again, if you have additional questions or want more detailed information, you're always welcome to contact us. HMOs are going to be the most common types of Advantage plans where you have networks that you have to stay in, providers and primary care providers that you have to use. Preferred provider or PPOs are a little more flexible. Fee-for-service plans can be the most flexible, but the hardest to use. Special needs plans or HMOs for people on Medicare and Medicaid. Again, if you want a complete list of all the plans available in Colorado, you can either go to medicare.gov and use the plan finder, or you can call 1-800-Medicare and request a Medicare new handbook specific to Colorado. In a Medicare Advantage plan, you still have certain rights. You absolutely have a right to access healthcare providers. You have the right to know how those providers get paid. You always have the right to fast, efficient, and timely appeal processes, especially in certain healthcare settings. You have an additional right for fast appeal processes. You always have the right to get the services that you need. You have the right to get information about that plan and what they're doing in easy to understand language. And you always, of course, have the right to have your personal medical information kept private. Things to take into consideration before you enroll in an Advantage plan. If that plan includes prescription drug coverage, keep in mind that you want to make sure that your specific drugs are covered by that plan, and not just assume that drug coverage means your drugs are covered. Every plan has a different list of drugs they cover. If you have doctors that you don't want to change or lose, make sure that those doctors participate with that plan before you enroll. If they do not, then you would not be able to use those doctors any longer. If you have a preference of hospital network, in Colorado Springs, we have 2 primary networks. Some people have very strong opinions of one over the other. If that's the case, you want to find out what network that plan participates with. If you doctor a lot or see specialists a lot, keep in mind that some plans may require that you get a referral to see a specialist each and every time. So now you're looking at having 2 appointments every time you want to make a specialist appointment. Those are the kinds of questions you want to ask yourself and the plan before you enroll in an Advantage plan. Handouts available for this, this kind of coverage. I included a handout that kind of explains the different types of plans and how they work, and kind of gives you a pros and cons of each plan, as well as I had a volunteer last year who was incredibly wonderful, put together a side-by-side at a glance sheet of all the Advantage plans available in El Paso County only, unfortunately. All the different plans, what kind of plan they were, whether or not there was a premium, co-pays for common services, what hospital network the plan contracted with. Very wonderful at a glance handout for you to have access to. Is good through the end of this year, but will change come open enrollment for next year. I also have one for Teller County, but those are the only two counties we've covered with this kind of handout this year. So that's Advantage plans in a nutshell. Quickly, we're going to talk about Medicare savings programs. Medicare savings programs are financial assistance programs specifically for people with Medicare. Eligibility is going to be based on income and assets or resources. Approval for this assistance could be as basic as it will pay the Part B premium, so that $148.50 is not deducted from Social Security each month. And at a lower income level, not only will it pay the Part B premium, but it also may pay the cost that Medicare left over, pretty much like a supplement, and you wouldn't need any other kind of coverage. If anybody wants any additional information about this program, you're always welcome to contact us. We help with these applications. I did include a handout that went over the information in a little bit more detail. But again, contact us if you have any questions or want more information. Lastly, we're going to talk about real quick Medicare Part D. Medicare Part D for drugs, the new prescription drug benefit of Medicare. This is the newest benefit of Medicare. It became available in 2006. Medicare Part D only covers outpatient drugs. So pretty much if the doctor hands you a prescription, you have to take that to the pharmacy to pick up a medication. That's what Part D covers. For Part D benefits, keep in mind that all the Part D plans will have their own formularies, which is their list of drugs that they will cover. Although there has to be a wide range of drugs that they will cover. Part D plans will have a monthly premium if you buy a standalone plan. Will have no premium if you enroll in an Advantage plan and it's included at no extra cost. Part D benefits may have deductibles, and you will always have copays at the pharmacy. There is also financial assistance available specifically for Part D that I will mention at the end as well. So again, enrolling in any part of Medicare is optional, so you don't have to enroll in Part D. To be eligible to enroll in Part D, you only have to be enrolled in Medicare Part A or Part B or both. So you don't have to be enrolled in both parts of Medicare to be eligible to enroll in D, only one or the other or both. If you have other credible drug coverage, you may not need a Part D. For example, if you are a veteran and you use the VA pharmacy, that is actually considered credible drug coverage. You could use the VA pharmacy and not enroll in a Part D with no questions asked, no late enrollment penalty if you enroll in Part D down the road. If you have drug coverage through employment or retirement benefits that are considered as good as or better than Part D, those are also credible. You would not need to enroll in an additional Part D plan with Medicare. You would want to carefully consider which option would be most cost effective for you by comparing the cost of what coverage you're being offered and what Part D may offer, as well as the coverage, the copays, the premiums, all of that kind of thing. If you do not enroll in Part D and you don't have other drug coverage options, for example, I get the question a lot, well, I don't take any drugs. Why should I enroll in Part D? Which is a very legitimate question. However, Just like with any part of Medicare, we don't always intend to use the hospital benefit. We don't always intend to use the Part B benefits, but we're going to enroll in them anyway, so we have health coverage. The same theory would apply for drug coverage. We may not necessarily intend to use it right away, but it's there in case we need it. If you choose not to enroll, you would be allowed to enroll any year down the road during the annual enrollment period, October 15th through December 7th, to be effective for January 1st next year, but you may be penalized for not having enrolled sooner or having other credible coverage. And that penalty again would last forever. The penalty is calculated a little bit differently. We'll talk about that in a sec. Again, enrollment periods for Part D are going to be basically the same enrollment periods for Medicare A and B. The initial enrollment window, the annual election window, which is that October 15th through December 7th, and then other special enrollment periods, which typically will involve some sort of other loss of credible coverage. Penalty for Part D is calculated a little bit differently than for Part B. So where the penalty for Part B is 10% per year tacked on to your premium, the Part D penalty is 1% per month for every month you could have been enrolled and were not. And that will be multiplied and multiplied by however many months, and then multiplied by the premium, the national average premium for Part D plans of the year you enroll. Whatever that comes out to is tacked on top of the premium for the plan you enroll in. Again, penalties are tacked on monthly forever and ever and ever and never go away. Unless you qualify for financial assistance in that case, penalties would not apply. So the bottom line is I discourage people from accumulating penalties of any kind for Medicare because they just last forever. Again, Part D premiums, as in Part B premiums as well, are means tested, meaning the higher income you make, the higher premium you may have to pay. I've included the chart for your reference, but I'm not going to go over it. Same basic thresholds, income thresholds before that penalties or that extra premium starts of $88,000 for an individual, $176,000 for a couple filing jointly before you have to worry about it. So what does Part D cover? So basically the way Part D benefits work, Medicare has created a standard outline of coverage that basically says there will be an annual deductible, meaning you'll have to pay full retail price for any medications you pick up until you spend the amount of the deductible, which this year is $445. Once you've spent that much money out of pocket in retail costs, the next time you go to the pharmacy, you'll be in your initial coverage level, where your cost of the pharmacy should be approximately 25% of retail or less. While you're paying your full retail price during deductible and you're paying only 25% of the retail price after deductible, Medicare and the drug plan are always taking the full retail cost of your drugs that you pick up and adding them up in a column over here. When the numbers in this column within a calendar year add up to $4,130, you will reach the next coverage level, which is considered the coverage gap or the donut hole. In the donut hole, you will continue to pay 25% of both brand name and generic drugs. Not 25% or less, you'll pay 25%. While you're in that coverage gap, Medicare is going to continue to add on to this column of costs that got you there, but they're only going to be adding the 25% you're actually paying now and not the full retail cost. If somehow your costs accumulate before the end of the calendar year to a total of $10,048 and change, you will hit what they call the catastrophic coverage level, where the costs for the rest of the calendar year for your medications, the pharmacy, would be 5% or a $3.70, $9.20 copay for generic / brand name, or whichever is less. And then come January 1st, it all starts over. And that formula starts over. Now, having said that, I can tell you most plans do better than this basic outline. So most plans offer better coverage than this. But it does pay to shop around because, again, there are 27 Part D standalone drug plans to choose from this year. And I think there are over 37 Advantage plans that include drug coverage this year in Colorado. As far as what's covered by Part D, Every Part D plan available must cover at least 2 medications in every class of drug. For example, if there are 20 different kinds of high blood pressure medication in that class of medications, a plan only has to cover a minimum of 2. They can choose to cover more, but they only have to cover a minimum of 2 in all medical classes. There are 6 additional classes of drugs that any plan available has to offer any drug available in those 6 classes regardless. They can't pick and choose. They have to offer anything that's on the market in those 6 classes. It's been a long Monday. I'm not even going to try and pronounce those 6 classes for you today, but they are listed, and everything available on the market is required to be covered by Part D plans in those classes. Also, keep in mind that only drugs that have been approved by the FDA require a written prescription from a medical provider and is written to be used for its medically intended purpose are covered by Part D. What that means is if a doctor is prescribing Viagra for high blood pressure, that is not the purpose Viagra was created for. Medicare will not pay for that. It has to be prescribed for its medically intended purpose. All plans must cover drugs, biologicals, and insulins, and the supplies for injecting insulins. And all plans must cover brand name and generic drugs on their formulary. However, if a brand name drug happens to go generic halfway through the year, I can guarantee you a plan is going to start requiring that you take the generic version versus the brand name that they've been paying for. Things not covered by Part D of Medicare, anything that was already covered under Part A or Part B. So if you were inpatient in the hospital and you were given medications in the hospital, that's covered under Part A, part of the hospital cost. If you are getting medications in Part B setting, such as chemotherapy, infusions that have to be done in a medical setting, injections that only your medical doctor can do in his office, those are Part B drugs. Only drugs that you take the script to the pharmacy are covered under Part D. Part D does not cover anything considered over the counter. And even if it requires a doctor's prescription, if it's specifically and solely used to treat anorexia or for fertility purposes or cosmetic purposes only, it is not covered by Part D. Even if it requires a written script from a doctor, if it is solely and exclusively used to treat cough and cold symptoms, guaifenesin or robitussin is a perfect example. It is not covered by Part D. And most over-the-counter vitamins and minerals or vitamin supplements are not going to be covered by Part D. Another handout that I included or that you can access is another publication put out by the Division of Insurance up in Denver. This lists all the Part D plans and all the Advantage plans in Colorado every year. So it's kind of going to give you the same list of plans and some basic information about those plans that you could find in the back of the Medicare new handbook specific to Colorado. However, this is just a nice short and sweet 4-page newspaper, but I did include that in the email, or you can access it from our website. Again, I mentioned there's financial assistance available specifically for the Part D benefit, different levels of assets and income to qualify for different levels of assistance. We help with these applications as well, or you can go to the socialsecurity.gov website and apply directly online. Application takes literally 10 minutes. You're supposed to also be able to call the 1-800 Social Security number and do it over the phone, or you're also always welcome to give us a call or shoot us an email and we can help you through that application. Approval for that assistance based on the income and asset levels can either reduce or eliminate the premiums for Part D, can reduce or eliminate the deductibles for Part D, and certainly it will reduce the copays at the pharmacy for any Part D benefits. Again, call us if you have any questions or want more information. If you don't qualify for assistance, but you still can't afford the brand name drugs that you need to take, we could also look at patient assistance programs that may be available directly from the drug makers. I've listed some of the websites that we use and find most helpful for that, that kind of search to see if a drug maker offers patient assistance or reduced cost or zero cost for the drugs that you take. and what the eligibility criteria is to qualify for that assistance. Typically, the patient assistance programs are going to be much more generous when it comes to income and assets. And so a lot more people may qualify. And they're typically going to require that you're not eligible for the extra help that we can help you apply for through Social Security. And we are about done. Went a little bit over time, but I appreciate your patience. Best resources available are going to be the Medicare and new handbooks, the Medicare.gov website, or again, you can always call 1-800-Medicare 24 hours a day, 7 days a week, 365 days a year, and they are happy to answer your questions. Or you're always welcome to contact us, your local SHIP office. This is what we are here for. This is what we do. Again, we are available here in Colorado Springs by appointment only. You're always welcome to call us. You're always welcome to email me at seniorinsure@ppacg.org, and I will answer questions as quickly as I can. And
You have several questions in the chat, Roma.
So let's take about 15 minutes and answer some questions for those who want to hang out. Go ahead, Pamela.
No, if you want to start with the first one, I know there was some differences between Medicare Advantage and supplemental plans. There was also one, I was working full-time when I turned 65, so I was required to have Medicare Part A. If I had needed to be hospitalized, would Part A be in effect in addition to my work medical plan?
So let's answer that question real quick. So if you are working full-time with employer group coverage, you enroll in Part A. Depending on the size of the employer, which doesn't have to be large, 20 or more employees, the employer coverage would be primary. However, most employer coverage these days tends to have a larger deductible than in past years. And so the employer coverage would be primary. If they apply deductible to that hospitalization, that balance could still be billed to Medicare Part A, and Medicare Part A may pay some of that balance minus the Part A deductible of $1,484. So there could be some advantage in that scenario to having Part A. So it would maybe cover some of your deductible. Otherwise, Part A would still be billable as your secondary insurance, whether they paid anything or not. So hopefully that answers that question.
If I don't sign up for Social Security at 65 years of age, do I still have to sign up for Medicare at age 65?
Unless you have active employer group coverage, yes, you should. You don't have to. Again, it's all optional, but you probably should so that you don't have to worry about late enrollment penalties later. Again, if you're actively employed with employer coverage or the spouse of an active employee with employer coverage, you could delay until that employment ends.
What is the difference in supplemental for Medigap or Medicare Advantage? What is the cost? I think you've reviewed some of that, but I don't know if there's still some question about that.
Yeah, if that question hasn't been answered, please type back in the chat box and I will for that information.
Okay. Does that count when you were talking about Medigap? Does that count for TRICARE too? If Medicare doesn't cover, supplementals don't cover it either? Does that account for
Not covered either, correct.
Right.
If someone has TRICARE instead of Medicare Supplement that's secondary to Medicare, typically TRICARE will not pay if Medicare did not pay either.
Right.
There are a couple exceptions to that rule, but typically that's how it's going to work.
Right. Is there still a donut hole in the Part D coverage? I think you've answered that when you went over Part D, but again, if there's still a question, okay. My spouse is already enrolled in Medicare Part A and B and a supplemental. Does he have to re-enroll during open enrollment, or does it automatically happen if no change is needed?
Medicare Supplement insurance is automatically renewable every year. There is no annual enrollment for that. Once you're in with a Medicare Supplement. Once you're out, you could be out. There is no annual enrollment opportunity for supplements, only Advantage plans and drug.
Does Medicare Part D cover insulin pump supplies?
Yes, depending. So Part D may cover pump supplies through an Advantage plan. If you don't have it through an Advantage plan, you have Medicare Supplement and Part D separately. Those supplies will probably go through Part B, as in boy of Medicare.
Now, I went over this as quickly as I could. If there's anyone whose question did not get answered, or you're still confused, I think there was a question about home health care. What is the 80% for DME? And I think Mr. Hillman answered that. Durable medical equipment is what he put in there. It's what we thought that DME stood for.
So even in a home healthcare scenario or a hospice scenario, sometimes if that home healthcare agency is providing you with a wheelchair or a hospital bed to use at home, that is billable under this, a separate part of Medicare, Medicare Part B as in boy, under durable medical equipment, and that may be only paid at 80%.
Okay.
One last question. If you're up for an Advantage plan to begin with, and then you decide to go into a Medigap plan, you have to be underwritten. Did I understand that correctly?
If you try an Advantage plan when you first become enrolled in Medicare, you have that 12-month test drive to try the Advantage plan without losing your underwriting or your guarantee issue into a supplement. If you go beyond that 12-month window, you could be subject to underwriting if you try and switch to a supplement. Yes. The way to avoid that, another way that you could get guarantee into a supplement in that situation is if you moved out of your service area of the Advantage plan, or the Advantage plan left your service area. That would also give you guarantee into a supplement.
Okay. I will just repeat what Roma mentioned earlier. If you want to get more details, there's the 4-part series in October 7th, 14th, 21, and 28. Our next session in this series will be a week from, it will not be next week due to the holiday. It'll be picked up on September 13th. And then we will have 4 consecutive Mondays at 4 o'clock for the retirement series. Due to the holiday, we were subject to a lapse in time there. So again, Roma is available for, you can email her. She's the best Medicare specialist in the state of Colorado. So I really encourage you to take advantage of this. Unless there's anything else going once, going twice. All right, going 3 times. Sold. Don't forget the survey. There's some incentive there to do the survey for us. We really appreciate it. And give us a critique.